Hi, this is Bedrest Coach Darline Turner, owner and founder of Mamas on Bedrest and Beyond, and today is Video Wednesday. We're talking today about having an advocate, and an advocate is a person that will speak for you or take up your cause, if you will, when you are unable to speak or advocate for yourself. I bring this up because I got an email from one of the Mamas on Bedrest, and I'm going to paraphrase it here because I don't want to expose her. She wants to be anonymous, and kind of paraphrase her story and the really important points that it brings up. So I got an email from a mama who said, I've been placed on hospital bed rest, and she'd been having some preterm labor, and they had stabilized her, and things were okay. She wasn't happy about being on bed rest, but it was what it was. And then about a week later, I got another email from her saying, I've been moved to a different hospital. This hospital is awful. The staff is really mean. I'm put in this room all by myself. I hate it here. I have to be here for 2 weeks. I don't think I can do it. I want to go back to the first hospital. My doctor's trying to do that, but no one's listening to me, and I'm going crazy here. What can I do? First of all, these are really distressing emails to get because, as an advocate for Mamas on Bedrest, my first thought is to go in and swoop this mama up and get her out of this icky situation. I don't even know where she was. She never actually stated where she was, and I don't get the impression that she's close to where I am. So, that's not a possibility. But what are some of the important things about the situation that we can all take away, and that all mamas on bed rest and all patients for that matter need to know? First and foremost, and I emailed this back to her and I haven't heard back, she needs to know clearly why she was transferred. And that was my first question. Well, why did they move you from one hospital to another? Was it a situation where the second hospital had facilities and treatments that she needed that weren't offered at the first hospital? Or, as what sometimes happens, was the first hospital overcrowded and they needed to move some patients? This is not a good reason, but this actually happens. And thirdly, did she have an insurance carrier such that for what treatments and procedures she needed, they could only be covered by the second hospital? So again, it is very important to find out why things are happening. She didn't reveal this in the email, and I'm hoping, she just was so upset that she didn't reveal it. But my concern is that this is kind of a common occurrence in that things happen, procedures are prescribed, treatments are advised, and women don't really quite understand what's being done and why, yet don't ask questions. You must ask questions. You must know why things are happening, not only to you, but for you. If it is in her best interest to be transferred to this second hospital, then by all means, let's do it. But at the same time, let's have it be a humane process. If she is having this much trouble, she needs to speak with hospital staff, social worker, care coordinators, and get her issues addressed. But first and foremost, what I was most concerned about was she didn't really seem to know why she had been transferred. And that's very concerning to me. So always ask, why am I being transferred? Why is this procedure being recommended? What are the expected outcomes? And what are the potential complications or negative things that could happen? So ask questions. Secondly, I didn't get the sense that she had a lot of people that she knew around her. And that, to me, is just a recipe for disaster wherever you are. You must have an advocate. I recommend that even when you're just going for a routine prenatal visit, you either take your spouse or partner, your mom, your sister, your best friend, somebody, because it can be overwhelming. You're already concerned, is my pregnancy okay? Is my baby okay? Is everything going to proceed? It's hard to listen when doctors get in their modes of, okay, this is what we're going to do, A, B, C, and D. And as a healthcare provider, we don't mean to, but we're focused on, okay, what are the steps that we need to do to make sure that this pregnancy proceeds or this person gets better. You know, that's where our head is. And sometimes we're speaking in what we think are very clear terms, and to a patient is not clear at all. Likewise, we're talking along, and if you're not saying anything, we're assuming you know what we're talking about and that you understand everything. And so often as the patient, you're so overwhelmed with the whole process, you don't even think about what you don't know until you're either in the car or at home or 2 in the morning. So that's why I say have someone go with you. Have an advocate. Have another set of eyes and ears who can say, hey, wait a minute, what does that mean? You know, why are you doing that? My thought is if this woman had her spouse or her mom or a friend, somebody there, it would be like, wait, why are you transferring her? You know, why can't she stay here? And these are the types of things that you just need that support. Finally, if all of that, you know, we figure it out that she needs to be at this hospital, it's the best place for her, her advocates are there, then we need to step in and say, okay, this is not okay that people are rude to me. This is not okay that people do things that I ask them not to do to me. I am not feeling comfortable here. I am not feeling cared for here. And those are really valid points. As a patient, you deserve that. I mean, as a person, you deserve that. And it is up to that hospital staff to attend to your needs. So in that case, you need to find whoever the care coordinator is on the floor, the head nurse or charge nurse, one of the social workers who kind of coordinates patient care and patient advocacy, and say to them, I don't feel like I am being treated properly. I don't feel like my needs are being met, and I don't feel comfortable here, because how you feel is going to impact how you do with your course in the hospital, whether it be for a high-risk pregnancy, whether it be for some other medical situation. If you don't feel well, if you don't feel comfortable, if you don't feel safe and secure, you're just not going to do well. And it is very important that you feel safe and secure and that you do well. So those are my 3 points. Ask questions. Why is this happening? Why do I need this? How is it going to impact me? How is it going to make me better? What could be the possible negative effects? Have an advocate. Have that extra set of eyes and ears there who can hear maybe when you're a little too jumbled and too in the situation, and say, hey, wait a minute, what about? You need that extra person. And finally, seek out the hospital staff members and keep asking and keep pressing if you don't feel you are being treated properly, justly, kindly, or in a way that makes you feel safe, secure, and in a manner that's going to help you to heal. So that's it for me today. Darline Turner, Bedrest Coach, owner and founder of Mamas on Bedrest and Beyond. Take care. Bye-bye.